Hello friends, how are you all? So today we're discussing up the most expected MCQs for the NEET PG, which is here only. And obviously these questions are easy only. My main motive is that you should get a thorough revision of various particular points, and in that, hello friends, how are you all? Okay, so in that, I suppose if you go properly in a proper way, then you will able to know a lot of things in this particular session of around 1 to 1.5 hours. So obviously these particular topics are high yield, fine, and you also fully involve up in answering this particular one, and then only it should be a by-way communication. It should not be like me only. You should also answer up. Hi Harpreet, good evening. Hi Neil, good evening. So obviously now in the recent exam also the all questions were from my notes only, and in this also we'll try up that the important aspects they are being touched, and you could able to get this particular session a high yield one. Okay, and first of all let's start up with Swami Vivekananda quote. Every work has got to pass through hundreds of difficulties, and that's true, okay, before succeeding. In this pathway only you are going off, that hundreds of difficulties are coming off in your path. So before succeeding, those that persevere will see the light sooner or later. Okay, so in Hindi what you get persevere, that जो दृढ़ संकल्प कर लेते हैं लाइफ में, those who have that particular thing in them कि ये तो करना है, so they always got to do that. Okay, time लग सकता है, it can be sooner or later, but it will be done, and I suppose you all will be able to do that for your parents, for your family, for yourself. Okay, so this is what we will start up with. Try to answer up yourself. I will give you slight bit seconds to answer. Try that. The first question is here. The culture media shown in the image is an example of. Okay, so basically I want to ask that in this, if this particular culture media is being given off, what comes in your mind? Okay. Hi Satyendra, good evening. So try to tell up this particular question, guys. Obviously a difficult one. This is a difficult one. Firstly I am telling up. Okay, this you must have not done up till, but this is a short which can come in your this particular exam. Okay, so tell me, Yashdeep have told A, Naseem have told D. Okay, anybody? Suman have told A. So guys, this is I will listen up that what all are answering up. 2-3 more comes, then I will tell you the answer of it. McConkey enriched. Okay. What else? Anybody else? Anybody else wants to tell this particular one? So guys, remember one thing, that this particular culture media you must have not seen up till in any of the sessions of any of others. This is the selective media for the EHEC identification. Okay, how many of you know this, that what is the selective media for EHEC? What is EHEC? First of all, it is enterohemorrhagic E. coli. Okay, what it is? It is enterohemorrhagic E. coli, and the selective media for that is shown up in this particular image. Okay, so those who don't know about culture, they can't tell you anything about it. Okay, so remember this particular aspect, that EHEC is enterohemorrhagic E. coli, which secretes up virotoxins and all. And if we talk about the culture media of it, the culture media is what? The culture media is SMAC. Okay, what is the culture media? The culture media is SMAC, that is sorbitol meconici agar. Okay, this is sorbitol meconici agar, and this was asked in the last NEET PG. This was asked that which is the culture media which we use for EHEC. So this time they can show you the picture. Now in this particular one, two pictures are there. One is yellow and one is pink. So this particular one is the picture of non-sorbitol fermenters. This is the picture of what? It is the picture of non-sorbitol fermenters. Okay, non-sorbitol fermenter. And remember this only, this particular aspect, that EHEC, enterohemorrhagic E. coli, जो bacteria है, that does not ferment sorbitol. It does not ferment sorbitol. That's why the colonies of that will look like on SMAC media this way. But most of the E. colis, they ferment the sorbitol. Okay, so those particular E. coli which ferment the sorbitol, they will look like this on which media? On the SMAC media. So this definitely can be one of the questions in your exam. So answer to this is B. Okay, answer to this question is B, and we have talked about which particular media? Sorbitol meconici agar. Is it fine? Fine. So this is the media, because like what they ask is the question here, that why we use a special media for EHEC. एंटीरोहैमरेजिक ई कोलाई के लिए हम स्पेशल मीडिया यूज करते ही क्यों है? व्हाई वी यूज इट? बिकॉज दिस पर्टिकुलर बैक्टीरिया इज non-sorbitol fermenter, and that's why it is being caught on the SMAC media. And if SMAC is not given the option, then you can go for another media whose name is rainbow agar. Okay, whose name is what? Rainbow agar. So remember this fact, if SMAC is not given in this, then the next best answer will be rainbow agar. Okay, and if they ask picture wise, this is the one which shows the growth of enterohemorrhagic E. coli. Okay, so is it fine, guys? So remember this particular aspect. Besides that, you remember this particular one, that various diarrheagenic E. coli, okay, diarrhea causing E. coli are which one? You already know them. Okay, the various diarrhea causing E. coli, that is, one is EPEC, one is EIEC, okay, one is ETEC, one is EHEC, and one is EAEC. Okay, so enteropathogenic E. coli, this particular one, enteropathogenic E. coli, this causes pediatric age group diarrhea. This causes what? Pediatric age group diarrhea. Remember that P for P, that you already know. Okay, and this particular EPEC associates with A/E lesions. Remember this aspect. A/E means what? Attaching, effacing lesions. Okay, what they are termed as? Attaching, effacing lesions means they attach to the intestinal villi and they damage them. So this is termed as A/E lesions, and they are seen in the EPEC. This is a definite, it can come in the exam. Entero-invasive E. coli. Entero-invasive E. coli resembles shigellosis. Okay, as it is invasive, Shigella is also what? Invasive in nature. So entero-invasive E. coli resembles shigellosis, and a test is positive in this, and the name of the test is what? Serenity test. Okay, Serenity test is positive in the EIEC. Fine. Then you have this, that is ETEC. ETEC is enterotoxigenic E. coli, and this you already know. This is traveler's diarrhea, most common cause. Okay, the most common cause of traveler's diarrhea worldwide is ETEC, enterotoxigenic E. coli. Is it fine? Now, how to remember T for T? So remember, in this particular aspect, somebody from America comes to India, and in India also that individual comes near AIIMS to Gautam Nagar and drinks our water. That fellow will definitely land up where? In the AIIMS. Okay, so this is what is ETEC, that is enterotoxigenic one, leads to traveler's diarrhea. Is it fine? So that fellow have to be admitted in the hospital with the complaints of traveler's diarrhea. Then enterohemorrhagic E. coli, which we are talking up here, this particular one secretes up certain toxins, and these toxins are named as virotoxins, that is VT1, and VT2. So this was also being asked once. VT1, VT2, what is it? Virotoxin 1, virotoxin 2. So that also is important to remember, that virocytotoxin or virotoxins 1, virotoxin 2, these are secreted by this EHEC. And this EHEC leads to which disease? It leads to HUS in the children. And what is HUS? HUS is hemolytic uremic syndrome. Okay, what is HUS? It is hemolytic uremic syndrome. And in the adults, it does what? Hemorrhagic colitis. In the adults, it does what? Hemorrhagic colitis. Fine. So these all are important entities to be remembered regarding the diarrhegenic E. coli. Okay. And the last one is enteroaggregative one, which leads to persistent type of diarrhea. This particular one leads to what? It leads to persistent type of diarrhea. And this persistent type of diarrhea, which is there caused by this EAEC, means over the weeks the diarrhea happens. And in the enteroaggregative E. coli also, you need to remember this aspect, that it also associates with traveler's diarrhea. And obviously, the number one cause is ETEC, and EAEC also does what? Traveler's diarrhea. Fine. Now, the next question. Which of the phases of the bacterial growth curve attain the maximum size? So this is a simple one, I suppose. An answer to this particular question, yes guys, answer up. This particular one, which of the phase of the bacterial growth curve attain the maximum size? Yes, please, answer up. That which of the phase of the bacterial growth curve attain the maximum size? The Naseem have answered up A. Very good. What else? Anybody else likes to answer? Yes, please. Nihal have answered up B. Tell. Which one? Harsh have answered A. Siddharth have answered C. So answer to this particular question is, as it is easy to remember, that is the lag phase. Okay, it is the lag phase. Dr. Mridul have answered the lag. Okay, so bacterial growth curve, guys, you already know it is like this. Okay, the first one is lag, then you have log, then you have stationary phase, and then you have decline phase. Okay. Lag, log, stationary and decline. This is the bacterial growth curve on which 100% one of the questions will come for sure. Okay. Lag phase. What is lag phase? Lag phase is when you put a bacteria into a new culture media. First of all, that particular bacteria adapts to the cultural media conditions. So that adaptation comes out in which phase? Lag phase. Okay, and it accumulates the nutrients. What it does? It accumulates the nutrients for the future. Okay, accumulate karta hai nutrients, and this particular individual sits and eats. Okay, बैठे बैठे खाता है, और बैठे बैठे खाने की वजह से इसका size हो जाता है increase. Okay, there is a increase in the size of this particular lag phase bacteria. Okay, then comes the log phase. Okay, so if we resemble this to our MBBS life, firstly, suppose if you are not a day scholar, you have gone to the hostel. So the first year of yours is the lag phase. You adapt to the medical college conditions. Okay, you accumulate the nutrients for your survival of what sort, emotions and every sort, and you are sort of depressed, you are away from the home, so there is an increase in the size. So this all thing happens in the lag phase. Then the log phase is what? Log phase is in which there is an exponential growth. And exponential growth is what? To the power n. Okay, what is that? To the power n. At this particular number, the bacteria divides. That is the log phase. And this particular log phase, maximum activity is there. Okay, there is a maximum activity there in the log phase, and there is an increase in number of the bacteria. There is an increase in the number of the bacteria. So this you need to know first, that the increase in the number happens to be in the log phase. And this is the log phase. If they try to ask up in a twist fashion, that what about the growth rate? Growth rate is constant, guys. Remember this particular aspect, that the growth rate is what? Constant. Okay, growth rate is constant. Why we say so? Because to the power n. So that is constant. Number increase, but the growth rate is constant. Remember this aspect. Okay, and this particular log phase is the maximum active phase, and this maximum active phase is used for gram staining. Okay, so the bacteria, if they are in the log phase, they are to be taken best. Okay, gram staining best particular. If you want to choose which one you will choose? You will choose the bacteria which are in the log phase. So this you need to know. Okay, then you have this stationary phase. Now after so much of division, what happens is there is a start of what? Start of the accumulation of what? Toxic metabolites. Okay, toxic metabolites starts accumulating up, and when these accumulating up toxic metabolites, the certain bacteria, they start dying off. Okay, so they die off and certain are live. So die or dead is equal to live. Okay, dead is equal to live in the case of what? Stationary phase. Fine. Then comes decline phase. And decline phase is what? Decline phase is in which there is a complete accumulation of toxic metabolites. Okay, the complete accumulation happens to be in the decline phase. That is the complete accumulation of toxic metabolites, and obviously in the decline phase the organism will die. So this is the bacterial growth curve. Again we can revise up. Lag phase, there is an increase in the size. Log phase, maximum activity increase in the number, but the growth rate is constant. And in the stationary one, the dead is equal to live. The start of accumulation of toxic metabolite happens here, and after this जब उसके पाप का घड़ा पूरी तरह भर जाता है तो उसको मरना पड़ता है. That fellow have to die when there is a complete accumulation of what? Toxic metabolites. Is it fine, guys? So remember this particular aspect. Important is that the question which comes again and again is, in which particular phase the sporulation happens? So sporulation happens in the stationary phase, and this particular thing is logical also, that why the sporulation happens in the stationary phase, because this is the phase in which the bacteria able to get a hint that the next phase is dying phase. If I want to survive up, then I have to produce a spore. So that's why the sporulation happens in which phase? S4S, that is the stationary phase. Is it fine? So this is one of the aspects. Another aspect which you need to know here is that exotoxin production. Okay, exotoxin production, this also happens in the stationary phase. Exotoxin production also happens in the stationary phase, and this is a new one, that antibiotics are also being produced by certain bacteria. In which phase? In the stationary phase. Antibiotic production also happens to be in which phase? That is the stationary phase. So remember this particular thing also. Is it fine? And then comes the final one, that is the decline phase, and in the decline phase the bacteria dies because of the complete accumulation of toxic metabolites. Okay, so in this, a new particular thing which I like to tell you, that innovulation forms, okay, which you have heard of in the case of diphtheria and all, these particular ones, they are in which phase? Decline phase. They are in which phase? Decline phase. So this is there, the stationary S4S, sporulation, exotoxin production, antibiotic production happens in the case of stationary phase, and decline phase you have which forms? Involution forms. 100% one question is there from this particular bacterial growth curve. Okay. Now tell this particular one, guys. The electron microscopic picture of an organism is being given off in this particular down one. So which is the best test for the diagnosis of this electron microscopic organism? Yes, please tell me. which particular one is there the answer of this particular question? Yes, Dr. Mridul, tell. Nihal, Harsh, tell up. What is the answer of this one? D. Dr. Harsh have told D. Okay. Any other? What is the answer of this particular question? Yes, please. Any other? What is the answer of this? Tell. You will get the PDF of this later on in the Telegram group. You can join up. They will give the link of the Telegram channel in the chat box only. So you can join up and there you can get the PDF of the session. Okay, Akshita. Answer to this question is, guys, D. Okay, answer to this question is what, guys? Direct fluorescent antibody test. Okay, and this direct fluorescent antibody test is done for what? It is done for antigen detection. Okay, it is done for what? Antigen detection. In short, it is termed as what? DFAT. That is direct fluorescent antibody test, and it is done for what? Antigen detection. And this antigen you take from where? You take from the nape of the neck. Nape of the neck, hair follicle, okay, and the corneal smear. These are the two sites from which you take up this particular sample. Okay. Now, we have directly gone up to this particular point. First of all, you tell me what this particular organism is all about. What we are talking about, what we are seeing in this. So actually this is bullet shape virus, and bullet shape virus you already know is which one? That is the rabies. Rabies is bullet shape. Rabies virus is bullet shape. Fine. And any of you, can you tell which particular one is the speed of this rabies virus? What is the speed of this particular one? So this is also a previous question only. 3 mm per hour is the speed of this particular one. Okay, this is the speed of the rabies virus when it goes from down to up. Fine. Is it fine? So if we go option by option, the culture on blood agar, obviously they do not grow. Virus do not grow on blood agar. Antigen detection from the blood, don't get the antigen from the blood. That is the antibody which you get in the serum and the blood. In virus specific antibody detection in serum and CSF, this is done, but better one is this. That is the direct fluorescent antibody test, and it is for what? It is for the antigen detection. And that particular antigen you get from where? You get from the nape of the neck. Okay, nape of neck hair follicle. Nape of neck hair follicle. This is taken. Another one is corneal smear. And these are for the ante-mortem diagnosis of rabies. They are for what? For the ante-mortem diagnosis of rabies. And this you already know that for the post-mortem diagnosis of rabies, you have demonstration of Negri bodies, which is being done from where? From the hippocampus to cerebellum. Okay. So Negri bodies, they are there, and these are intracytoplasmic eosinophilic inclusion bodies. They are intracytoplasmic eosinophilic inclusion bodies, Negri bodies, and they are being demonstrated by which method? Seller's technique. This can also be asked. They can be like by which method? Seller's technique. And Kishore have perfectly said that 100% mortality is there in the rabies. Okay, 100% mortality is there in the rabies. Now, certain one-liners regarding the rabies, if you want to know, that what is the family of it? The family of it is Rhabdoviridae, that you already know. Okay. Then, what is the subfamily? That is Lisa virni. Okay, Lisa ko rabies ho gaya. Remember like that. Okay. Speed of this 3 mm per hour. How many types of it is? It's the natural rabies and another one is dump rabies. Dump rabies is done by the vaccine virus, and the natural rabies is done by the, obviously, the street virus. That is which is the natural one. That does the furious rabies or natural rabies. Okay. Then important question which have recently come is that which particular areas in the India they are there where rabies is not there. So water isolated areas, Lakshadweep and Andaman Nicobar, they are not having rabies. So this is also one of the aspects to be remembered of. Another than important is that suppose if somebody asks you that those post-exposure prophylaxis and all, still that is 0, 3, 7, 14, 28. Fine. So that is also to be cleared off. Fine. So these are the important entities regarding the rabies virus which you need to know. Another one which can they be asked in the exam is, it is a single stranded virus or a double stranded virus. It's a single stranded RNA virus. Okay. It is enveloped. Okay. This particular one is enveloped, and this is having a negative sense. Okay. And what is the meaning of negative sense? Negative sense means are those viruses which firstly change into positive sense with the help of enzyme. Okay. And why they need to change from negative to positive? Because to replicate. Otherwise, they will not able to replicate. So this is the meaning of negative sense. And other aspect is negative sense means what? Is it reverse coiled? Firstly, it uncoils and then replicates. So this is the logic of this negative sense changes to positive sense. Fine. So these are the important questions which can come regarding the rabies to you, and you could able to answer up that particular one. Fine. Now, tell about this particular one. Tell about this particular one. A 22-year-old male is brought to the hospital due to the fever, frontal headache, photophobia, nausea, vomiting. Okay, obviously you must be getting up from this what they're talking about. The physical examination shows positive Brudzinski sign. Okay, the neck flexion, the legs are also flexed, knees is also flexed. The lumbar puncture was done, and the CSF analysis shows slight increase in the opening pressure, which is like more than 180 mm, and normal protein and glucose levels. Okay, it can be like different way also. Normal protein, glucose levels, leukocyte count of 200. Okay, what is the most likely organism implicated in causing the above conditions? So can you tell me the answer, guys? First of all, Kishore, you are perfectly right. It's meningitis. But what is the answer of yours? Is it Streptococcus pneumoniae which has done this? Is it Neisseria meningitidis, enterovirus, or HSV? What it is? Naseem have told B. But Naseem, you are wrong here. This is not B. Tell. Yes, please. Tell. Yeah, tell. Is it the Streptococcus pneumoniae? Is it the meningococci? Is it enterovirus? Is it herpes simplex virus? What is the answer? Harsh have told the perfect answer, and Dr. Mridul also have told the perfect answer. The answer is enteroviruses. Enteroviruses are the virus which are the most common cause as per the viral meningitis. Okay. Yeah, very good, MA. You have perfectly answered up this particular one. So this particular one is the most common cause as per the viral meningitis, enteroviruses. Okay, they are the ones. And why we say so that enterovirus is there in this particular one? Because herpes simplex virus is also there. So basically the picture of the CSF analysis which we are talking about here, it shows up increased opening pressure. It means the pressure is increased somewhat. Normal protein and glucose. Okay, some says it can be a slight increase in the proteins, or there is a slight decrease in the glucose levels also. But normally in a viral one, normal protein and glucose, it is there. And leukocyte count is also not much raised, it is around 200. So most of the aspects are on the normal range. So answer of ours will be going towards the enterovirus, because most likely they have asked of, the answer is entero. Okay. Now this particular thing is termed as aseptic meningitis. We call it as what? Aseptic meningitis. This is termed as aseptic meningitis, and enteroviruses is a cause of it. Okay, is a cause of it. That is the aseptic meningitis. Fine. Now herpes simplex virus, if you have read my notes and all, you already know that it associates with causing up a meningitis termed as Mullaret's meningitis. Another frequently asked question, that Mullaret's meningitis is done by what? HSV only. HSV 1 and 2 they does that, but HSV 2 does more than one. the Mullared's meningitis. Remember this particular aspect also. Now, why this particular Streptococcus pneumoniae and this particular meningococci is not the answer? So guys, remember this very simple facts that if we talk about the pyogenic meningitis, the pyogenic meningitis is having a very much increased pressure, CSF pressure, okay, that is very much increased. Then in the pyogenic one, pyogenic means bacterial one, the neutrophils, they are increased a lot. It is not only 200, they can go up to 20,000 here, okay. Then the bacteria क्या होते हैं? Bacteria होते हैं भुक्कड़, so they eat up the glucose. So there is a markedly decreased level of the CSF glucose, and because of the permeability increase, there is a very much moderate to markedly increase in the protein levels, okay. Protein levels of the CSF markedly increased up in the pyogenic meningitis. Short the question will come. Yes, Mridur, you are right. In bacterial meningitis, sugar decrease, protein increases, and that too markedly. Okay, moderate to markedly increase there, and the leukocytes which increases neutrophils. Okay, and there is a sufficient increase in the CSF pressure. So that's why this is not the answer there. That's why the antiretrovirus was the answer. Okay, and regarding here, we can talk about the mycobacterial also. That is the TB meningitis. TB meningitis, the most important word is cobweb coagulum, which you are able to observe up. And because of this TB meningitis, there is also a sufficient increase in the CSF pressure. Okay. And here, instead of neutrophils, what increase? Lymphocytes. What increase here? Lymphocytes are increased rather than the neutrophils. And CSF glucose decrease here also, but not so much as compared to the pyogenic ones. And there is also a markedly increase in the proteins here in the case of TB meningitis. Is it fine? So all these are important aspects on which the question can come. They can revolve around this and they can ask you. Okay. Now, what about the fungal one? The fungal meningitis like cryptococcus and all that, they go hand in hand with the viral meningitis. The fungal one. Means here also the sugar levels, here also the protein levels, they mostly remains normal. Okay, there is a slight increase in the pressure if at all it is there, and these particular aspects mostly remains in the normal range in the fungal as well as viral stuff. Okay, and if they talk about the viral one, so that is the enteroviruses which you need to know. Is it fine? So, and all those features which are given in the question, these particular ones, that it shows fever, frontal headache, photophobia, nausea, projectile vomiting, they all are features of what? Meningitis. Is it fine? So, 100% this question is there in your exam in some form or other. And recently one question came in which all picture is of pyogenic meningitis, bacterial meningitis, but in the last line, that particular one writes of what? In the last line written up that on culture, this particular one is coming negative. And everybody is confused that the picture is of pyogenic meningitis, but on culture, the things are coming of the CSF culture, the things are coming negative. So remember a fact from the Harrison that most cases you could not able to culture of the organism. Okay, it is hardly 40% you could able to have the yield of the culture, other 60% you miss out on it. Hi Dr. Bhavar, hi Sky. So like we have talked about the meningitis here, and these are the various aspects which you need to follow up. Okay, 100% one question is there from it. And the new concept which you have gone, the viral one, in the viral also most common is enteroviruses. HSV associates with Mullared's meningitis. Is it fine? And the pyogenic one I have told you, fungal what we call cryptococcus. And cryptococcus they talk in and around that. Indian ink staining, okay, that particular negative stain, and it causes meningitis in HIV positive one. In fact, this is the most common cause of meningitis in HIV positive ones. Fine. You go for latex card test, you go for PCR there, you go for Indian ink testing here. And the recent question is, what is the drug of choice for cryptococcal meningitis? That is LAMP, liposomal amphotericin B, along with the flucytosine. Is it fine? Then, next question. The burn patients often develop infection. Okay, the hint is the burn patients often develop infection, and the sample was collected. That particular burn patient sample was collected, means some sort of a pus that is being collected. An organism was found to be obligate aerobe. Okay, the organism is found to be what? Obligate aerobe. Fine. Obligate aerobe means which needs desperate oxygen. And it is found to be oxidase positive, and it is best cultured on this particular media, that is the citrimide agar. Yes, please. What is the answer? Dr. Mridul have answered is Pseudomonas. Dr. Bhavar have answered it C, that is Pseudomonas, and Kishore also have answered it C. Okay, and answer is C only. You all are perfectly correct. Okay, this is the oxidase test. Okay, and what is oxidase test? Within 10 minutes, this particular disc or a paper changes color from white to blue, and this should happen in how much time? Within 10 seconds. Okay, this is the oxidase test. And what about the other test? That is the catalase test. They can confuse you with this also, the catalase test. The catalase test you already know, 3% H2O2 That is the catalase test. And Pseudomonas is found to be catalase and oxidase both positive. Okay, it is found to be catalase and oxidase both positive. Is it fine? And there are sufficient hints in this question, and this is the way the questions will be coming in the NEET exam this time and in the future ones. Okay, actually why? Because there is a principle that is termed as Pareto principle, and Pareto principle says that 20% of the topics, they come 80% of the times. Important will always remain important. That will always come in every exam, whether it is NEET or next or anything, that will come. So this also applies up, that these are important organisms. They will be coming today also, and tomorrow also they will come in some form or other. And with that some form, I've told you in which fashion they can come. Burn patients, they can give you this, and they can correlate with this oxidase test. Either they can correlate with the catalase test also. They can give any of the hints like obligate aerobe here and oxidase positive, and the culture media itself is crying off that it is Pseudomonas. The answer is citrimide agar in that. That is Pseudomonas aeruginosa. The best grows on the citrimide agar. And here also is the rationale that citrimide is a disinfectant. This particular Pseudomonas loves to grow on the disinfectant. So this is another question, that which particular organisms loves to grow on the disinfectants. It does not allow Savlon and Dettol also to settle. It can grow in them also. So Pseudomonas is that sort of a bacteria which can grow up in Savlon and Dettol also if they are exposed up for a very long time. Fine. Then another very important question, guys, is anti-pseudomonal drugs. They should be on your tips. 100% one question is there from there, anti-pseudomonal drugs. And in that, in short, I like to tell you that vancomycin and ceftriaxone, okay, vancomycin and this particular drug ceftriaxone, they are not anti-pseudomonal. So this you need to know, that they are not anti-pseudomonal. Which one? The vancomycin and ceftriaxone. Otherwise, that full list should be on your tips. Okay, that should be on your tips. And the question which I think can come now is regarding the Acinetobacter baumannii. Okay, and why it is important? Because this is the organism which is causing a problem for the ICU patients. Okay, why? Because this is being isolated from the endotracheal aspirates and all, and it is found to be MDR, multi-drug resistant. It is found to be in most of the cases, and it is found in the ICU patients. This question is coming, and when I say it's coming, it comes. So MDR in the ICU, these isolates, they are mostly coming of whom? Acinetobacter baumannii. And why I am saying this? Because WHO have also noticed the same thing. WHO is saying that they are putting this into the critical list of bugs. Okay, because they are also bothered that why this is coming from the ICU, and in that also it is coming MDR. So that's a problem. Okay, so this is the logic that Acinetobacter will be coming in your exam. Okay. So remember this name, Acinetobacter baumannii, and important to differentiate between the Pseudomonas is it is oxidase negative. Okay, this particular one is oxidase negative, And this particular aspect, that which one is oxidase negative, which one is oxidase positive, what is the utility of them in the clinical specimens every day when you process a, definitely it can't be told by those who have not done it. Okay. So, and this correlation will be coming in the next exam or NEET exam nowadays. Okay. So you should know that which one is oxidase negative, which one is oxidase positive, which one is catalase and oxidase both positive. That is also to be remembered of. Okay, guys. Hi, Dr. Akshit. Good to see you here. Fine. So these are the important aspects which you need to know regarding the Pseudomonas and the Acinetobacter one. And we have learned them in which chapter? They are non-fermenters. What they are? They are non-fermenters. Fine. Now, simple one. Tell me about this. All are true about the endotoxins except. All are true about the endotoxins except. Yes. Dr. Akshay, Dr. Bhavar, Kishore, Satyendra, tell me, which particular one should be the answer as per you? Yeah, tell. LPS in nature? Yes. Lipopolysaccharides, gram-negative bacteria, they are having it. So, that will secrete a endotoxin. That is fine. It is produced mostly with the gram-negative ones. True. Heat stable, it is heat stable. Toxoid can be prepared from it? No, you can't prepare toxoid. Toxoid can be prepared from the exotoxin, which is secreted by the gram-positive bacteria. So, answer is D. Answer of this question is D. And some more aspects which I like to tell you regarding the cell wall and all that. Those particular aspects are this. The gram-positive bacteria, okay, is having a thick layer of peptidoglycan. That you already know. It is having what? A thick layer of peptidoglycan. And the gram-negative one is having a thin layer of peptidoglycan. So, this is a aspect which you already know, which influence which particular staining? Mostly gram staining. It influences what? Gram staining. So, this is to be remembered. Okay. Now, the thick layer of peptidoglycan and thin layer of peptidoglycan, this particular thing determines the gram staining of an bacteria. That you need to know. Besides this, the added point which I want to tell up, those who have joined up, that is teichoic acid. This particular organism structure, teichoic acid. Teichoic acid is a feature of gram-positive cell wall. Okay. Outer membrane is a feature of which particular cell wall? It is a feature of gram-negative cell wall. It's a feature of gram-negative cell wall. And how to remember that? Remember in this particular fashion, guys, P, gram-positive. Positive लोग जिंदगी में ज़्यादा टिकते हैं. तो teichoic acid is a feature of what? Gram-positive. Outer membrane. और जो जिंदगी में ज़्यादा नेगेटिव रहते हैं ना, वो लाइफ की रेस से हो जाते हैं बाहर. तो outer membrane is a feature of what? Gram-negative. And gram-positive have an additional structure that is termed as teichoic acid in the gram-positive cell wall. Is it fine, guys? So, this you need to know regarding the endotoxins, exotoxins and these particular important aspects which are being covered just now. Okay. Like they already have come in the recent exam. This lipopolysaccharide which is there in the gram-negative bacteria, lipopolysaccharide is there in the gram-negative bacteria. This particular one is having the O antigen. Another all India question which have come. From where this O antigen derives? The answer is it is derived from the lipopolysaccharide. Okay, it is derived from where? From the lipopolysaccharide. And what is O? O is somatic. Somatic antigen is O and H is what? H is flagellar. H is what? H is flagellar, that is flagella. And this derives from where? This derives from this. Is it fine, guys? Okay. Now, tell about this simple question. The false about the epidermophyton. First of all, tell me what is epidermophyton. Epidermophyton is a dermatophyte. This you obviously must be knowing if you are preparing for this particular exam. So, it's a dermatophyte and it's a epidermophyton. What is the false statement regarding it? It involves skin and nail. It involves skin and nail. That's true. It's true. They involve skin and nails. Fine. Microconidia, they are absent in it. Yes. Microconidia, they are absent in this particular one. Macroconidia, they are pencil shape. This statement is wrong. It causes what? It causes superficial infection. It's a cause of superficial mycosis, dermatophytosis. Okay. So dermatophytosis is the cause of what? Superficial mycosis. So it causes superficial infection. True or not? Is it fine? Okay. Yes, please, guys. So answer to this particular question is what? Answer to this particular question is C. C for Calcutta. The answer is C. Macroconidia is not pencil shape. Okay. Very right, Nil Sarkar. Very right, Dr. Bhavar. Answer is C. Now, they can definitely correlate up the various dermatophytes with these macroconidia shapes, and they can ask you in the exam for sure. This is also one of the short questions. So this particular one is termed as pencil, or it is cylindrical in shape. And which one we are talking about? We are talking about trichophyton. We are talking about what? We are talking about trichophyton. This is regarding the microsporum, and microsporum is having a spindle shaped macroconidia. It is having a spindle shaped macroconidia. It is having a spindle shaped macroconidia, and the club or boat shape, okay, club or boat shape is a feature of which particular one? That is a feature of epidermophyton. It is a feature of epidermophyton. The duration of the class, Siddharth, is around 1 hour 30 minutes. Okay. So club or boat shape is epidermophyton, spindle shape is microsporum, trichophyton is pencil or cylindrical in shape. Okay, and how to remember them in a sequence? Write like this, TME, and one side you write up macroconidia, and one side you write up microconidia. And what is the conidia, guys? Conidia is a spore. So one is macroconidia and one is microconidia. Trichophyton, yes, you should tell. What is the answer? Trichophyton, pencil or cylindrical in shape. It is pencil or cylindrical in shape. Microsporum, it is spindle in shape. Epidermophyton is club or boat shape. Club or boat shape. And microconidia here, in this particular one, they are numerous. In the microsporum, they are less. And in the epidermophyton, there is a absent microconidia. And this is what is the question, that absent microconidia is a feature of. So absent microconidia is a feature of epidermophyton. How to remember them? So remember like this, trichophyton, tri, okay, pencil. Another name for that is cylindrical, pencil or cylindrical. So remember in this particular fashion, guys, tricycle. Remember like this, tricycle. Microsporum, SP, spindle. Epidermophyton. So epi means above. So you have to imagine up like this. Over a club, what is there? A boat. So these upset associations helps you to remember for a long time. So this is one club. Over a club, what is there? A boat, and that is epidermophyton. And in that club, which are not allowed to go? Small children. So microconidia is absent in whom? Epidermophyton. Whereas they are numerous, tri. So that is in the trichophyton. Microsporum, micro means less. Less of the microconidia is a feature of microsporum. Is it fine? So you need to know these all particular questions regarding the dermatophytes, and because this is the, like what you say, microbiological aspect here, which is definitely be correlated with the disease, and they will try to ask you up. Okay. Now, can you arrange them into the order of being most to the least resistant? Most to the least resistant. Yes, Dr. Bhavar. Yes, Dr. Siddharth. Can you tell me about this? Arrange the following in order of being most to least resistant. These particular ones. Tell. Yes, please. Tell me this, that in the order of being most to least resistant, what should be your answer for this particular one? A, B, C or D? Which one? What is the answer? Dr. Akshat have told B, Dr. Siddharth have told B, Sky have told B, Bhavar have told B, MA have told option A. MA, this time you are wrong, guy. Answer is B. The most resistant form on earth is prions. Okay, after that comes the spores. Fine. Then comes the mycobacterium. Then the non-enveloped viruses. This is also, they can play the trick with you. Enveloped or non-enveloped. Naked viruses are more resistant than the enveloped virus. So this also needs to be remembered. Now, something about sterilization and disinfection, which are like important questions which can be there. So if somebody asks you regarding the sporocidal agents, okay, the sporocidal agents, guys, you already know EFGH. These are the sporocidal agents, EFGH. Important ones. One is ethylene or ethylene oxide. F is formaldehyde. F is formaldehyde. G is glutaldehyde. And H is hypochlorite. And obviously, which hypochlorite? Sodium hypochlorite. Okay, sodium hypochlorite 1%. 1% sodium hypochlorite is also sporocidal. So these are the ones which are sporocidal, which you need to know. Okay. Along with them, you can write off even the autoclave kills it, even the hot air oven kills it. They are also termed as what? Sporocidal stuff. Obviously, they are not chemicals, but these are the ones which are ethylene oxide, ethylene oxide, formaldehyde, glutaldehyde, 1% sodium hypochlorite. So this is used for the blood spills. Frequently asked question. Glutaldehyde 2% comes in the market by the name of Cytex. It is used for endoscopes, cystoscopes and all that. Formaldehyde is in the form of formalin. It is used for the anatomical preservation of the specimens. Okay, and formalin gas is there. Formaldehyde gas is there, which is used for the like fumigation of the OT. And ethylene oxide is used for a number of purposes. It is used for the respirators, okay, ICU machines. It can be used for the cat gut sutures. Okay, this can be used for what? Cat gut sutures. This is a new one. If somebody asks you gamma radiation or ethylene oxide for cat gut sutures is the best, answer is ethylene oxide is the best for the cat gut sutures. Even the dental equipments you can sterilize with the help of ethylene oxide. Dental equipments you can sterilize with the help of what? Ethylene oxide. Is it fine, guys? So these are the various sporocidal ones which you need to know. And if I ask you like 2-3 important ones which are recently being asked. So Bacillus styrothermophilus, this particular organism is used as a control. It is used as a control for which particular instruments or which particular techniques. So answer is Bacillus styrothermophilus. The spores of Bacillus styrothermophilus, which comes like in the market ready-made, they are being used for the autoclave. So they are used as a control of autoclave. Okay, they are used for this particular one, and it is also used for the plasma sterilization. Okay, it is also being used for what? Plasma sterilization control. And this was asked in this particular recent exam. It was asked that it is being used for the plasma sterilization and autoclave. Bacillus styrothermophilus, which particular gas? Another recent question is used in the plasma sterilization. Answer is hydrogen peroxide gas. This particular one is used in the case of plasma sterilization. Free radicals are there in that. That is being used for the sterilization. Okay. So remember this particular one, not the PCR. PCR you don't use styrothermophilus. Okay. That is Thermus aquaticus nil. That is Thermus aquaticus PCR. So this is a simple one, guys. When a bacteriophage is involved in causing a gene transfer, this particular process is termed as what? Is it transformation, it is conjugation, transduction, or none of them? Yes, please, tell me. So when you will answer up, then only I will move forward. Okay. That when a bacteriophage is involved in causing gene transfer, it is known as transformation, conjugation, transduction, none. Tell. Fast. B. Siddharth, why you are telling B? Akshat also B. Why? The answer is C, na? Whenever a bacteriophage comes, a bacteriophage comes, we talk about what? Transduction. Not conjugation. Okay? So remember, like, whenever we have this word of bacteriophage, we talk about what? Transduction. Conjugation, no doubt, is the most common cause or most common method of resistance transfer. There is no doubt in that this is the most common method of resistance transfer between the bacteria. That is the conjugation, through the conjugation tube, the transfer of. And this transformation, this particular experiment was done by the Griffith on the mice with the pneumococcus, that also you know. And transduction is a bacteriophage. Bacteriophage is what? A virus which eats the bacteria. Okay, a virus which eats the bacteria, and that particular virus, after eating up the bacteria, takes the genes of it and later on goes to some other bacteria and gives it a new one. So this is the transduction. It can be generalized, it can be restricted. Generalized means any portion will go, or restricted means a specific particular segment will go. Okay, and the new thing which I want to tell up here to you is this particular thing. Okay, so this nobody will tell that, and this can also come in your exam. The first example of gene transfer by transformation. Yes, the first example of gene transfer by transformation. So obviously just now I told you pneumococci done by the Griffith. Okay, the first example of restricted transduction, a specific sequence, with E. coli. In that, a number of experiments were done, galactose genes and all that. Okay, so that is also there. The example of lysogenic conversion. Lysogenic conversion. Lysogeny means what? The prophage formation. In the transduction, there is a formation of prophage. Means in which a hybrid is produced. That is termed as lysogeny. So example of lysogenic conversion is Corynebacterium diphtheria or Corynebacterium diphtheria. And if you have seen up my lectures, you must be knowing up, I say a line that every Corynebacterium diphtheria is not pathogenic. It is made pathogenic by what? A particular gene, tox gene, given by which particular phage? Beta phage, and that process is only termed as what? Lysogenic conversion. Is it fine? And the first example of conjugation happens to be in which particular E. coli? K12 strain. Another potent question which can come, that the first example of conjugation happens to be in which E. coli serotype? E. coli K12. K conjugation. K for K. Okay. The first example of transferable multi-drug resistance. I have told you which needs a resistant factor, that is termed as transferable multi-drug resistance, said to be happening in the Shigella. That is said to be happening in whom? That is said to be happening in the Shigella. So this also needs to remember. Is it fine? Okay guys. So these are the important ones on which definitely a question can come. Restricted transduction, E. coli, conjugation, E. coli K12, okay, transferable drug, multi-drug resistance. Because of that multi-drug resistance happens now, you know the transferable and mutational are there. Mutational happens to be in TB. The mutation happens with the genes like RPBO gene, INH gene, CATG gene, all those are there, okay. But first example of it is Shigella, in which this particular study was being made. Is it fine guys? Now, coming to this, another simple one. Antibodies producing opsonization and activating which complement pathway? That is the classical complement pathway. So this I suppose everybody will answer up. This is a simple one. I have kept it simple because the simple things sometimes goes wrong in exam, and when the simple thing goes wrong in the exam, now your rank goes many folds. Okay, so simple things you can't make wrong for sure. Simple things you can't make, you can't take risk of making them wrong for sure in the exam. And even single question matters. Okay, a single question matters. So guys, what's the answer? Please tell me. Yes, Bhavar, you are perfectly right. Answer is IgG and IgM. Sky, also you are right. Any other wants to try off? Akshat, B. Very good. So answer to this question is B, IgG and IgM. These are the antibodies which are opsonizers also, and they play a role in classical complement pathway. Okay, C1 to C9, they are the complements of us. Okay, and let's talk about the antibodies, important aspects. If you also know, you can also answer up. which is the antibody which is maximum in concentration? The answer is IgG. Okay, which is the heaviest antibody? Okay, max concentration, IgG. Max weight, molecular weight, the max molecular weight is there in, yes guys, IgM. Okay, max molecular weight is there in what? IgM. Which particular immunoglobulins they have J chains? J chains is a feature seen in M and A, that is Ma. Okay, J chains are observed in what? Ma. M and A. You have joining with your Ma, na? So joining chains is a feature of IgM and IgA. Which particular antibody is present in the secretions of the body? So answer is IgA, that is present in the secretions. In that, the IgA1 is present in the serum and IgA2, which is a dimer, it is present in the secretions. Okay, the various secretions of the body. The IgA2 is present, which is a dimer. This is a monomer. Fine. And they have which particular chains with them? They have the joining chains or J chains. This also needs to be remembered. Fine. Another important aspect which you need to know here is that which is having the maximum T half. The answer is IgG. This is having the max T half. Fine. Which is having the least T half? The least T half is IgE. Which plays a role in type 1 hypersensitivity? IgE. Okay. Which shows homocytotropism? IgE. In the case of IgG, which particular serotype or subtype is the most common? Answer is IgG1. Okay. And every particular antibody, if it is having the heavy chains, it is also having the light chains, guys. Okay. It is also having what? A light chain also. So light chains, they can be kappa, they can be lambda. And kappa is to lambda ratio is what? 2:1. How to remember? This is having two P's, PP. So 2:1 ratio is there for the kappa is to lambda light chains. Okay. To kappa is to lambda light chains, the ratio is what? 2:1. Is it fine, guys? So this is also a number of things which you need to go. And recent question was in multiple myeloma, which light chains are seen? So in multiple myeloma, guys, remember in this particular fashion, in multiple myeloma, it is not IgM, it is IgG which is present. And which particular chains are there? Kappa light chains. They are there in the multiple myeloma. Okay, they are there in the multiple myeloma. So these are the various particular questions possible from the antibody stuff which you need to know. Which is the first antibody to come in any of the reactions? The answer is IgM. Okay, why is it so? Because IgM is the one which is sitting over the B cells. It sits over the naive B cells. That's why that is the antibody which always comes in the first place, IgM. Okay. Now tell this particular one. Autograft, xenograft, allograft and isograft. And what is your answer in that? Yes, please. What is your answer in that? देखो, one thing I can say very easily, if you do this much also, na, in and around you listen up to this, 10 questions of yours, they are not going anywhere. Okay, easily you could able to see. Acha, alternate or lectin pathway in short. So alternate pathway, guys, MA. Remember one thing, that this particular alternate pathway starts from C3. Okay, this particular one starts from C3. And if you know this one, C3 small b, capital B small b, this is the C3 convertase. Okay, this is a C3 convertase. This you need to know regarding alternate pathway. C3 is the starter and C3 small b, capital B small b is the C3 convertase. Fine. So they ask that which complements are not involved in alternate pathway. So answer is C1, 2, 4. Okay, these are the complements which are not involved in the alternate complement pathway. This is regarding the alternate, which you need to know, MA. Okay, another important aspect which I like to ask you here is that this particular lectin pathway starts from C4. It starts from where? It starts from C4, and obviously if it starts from C4, then which particular complement is not involved in that? So basically the sequence you know, na, classical complement, it starts from C1, then comes the 4, and then comes the 2, 142. This is the sequence of them. Okay. So if it starts from 4, which complement is not involved in lectin pathway? The answer is C1. So this also needs to know that the lectin pathway starts from C4. That's why C1, that is complement 1, is not consumed. Whereas in the alternate pathway starts from C3, which all are not consumed, 142. I suppose MA, that is clear to you. Okay. Now coming back to this graft stuff, you have answered up beautifully. Answer is D. Autograft is there for the skin grafts, very right. Xenograft is transfer between the different species, that you also know. Allograft is most of the transplants are allografts only. Okay. And the D is third one, that is the monozygotic twins, that is the isograft. What is the other name of isograft, guys? The other name of isograft is syngenic graft. The other name is syngenic graft. Okay. The other name of it is what? Syngenic graft. The answer is D. What is the answer? Answer is D. Now, here only you tell me what is the acute rejection, what is hyperacute rejection, and what is chronic rejection. So, this particular hyperacute rejection, okay, hyperacute reaction, this particular one is due to the preformed antibodies. Okay, it is due to the preformed antibodies. Means already they are in the vasculature, and immediately when you put a graft, it is being discarded. That is termed as, it happens in minutes. Okay, it happens in minutes to hours, hyperacute reaction or hyperacute rejection. Because already the preformed antibodies are produced and they are over the vasculature and they discard it immediately. This is preformed. Okay, minutes to hours, very right. Acute rejection takes time, and in that the same thing happens, antibodies are produced, and in a simple way, if you say that is rejection vasculitis, you call it as what? Rejection vasculitis, acute rejection, and it takes time. Fine. And over the months to years, that is termed as chronic rejection. Okay, that is termed as chronic rejection. So the most important thing is this one, that hyperacute rejection happens due to what? Preformed antibodies in the vasculature. Okay, and acute one, in this also the antibodies are produced, but they take time. Okay, so it does not happen in minutes to hours, it takes time, days to months it takes, and chronic is over the years, months to years. So you can remember in this particular sequence. Okay. Now guys, this is the question which is likely to come in the exam. This you need to know. The following culture media is used for the culture of which organism, and which culture media it is? It is chrome agar, guys. Okay, this is which culture media? This is chrome agar, and the chrome agar is used for which particular fungus out of them? Yes, you can tell that this particular is chrome agar, and this is used for which particular fungus? The answer is Candida. Okay, as all are telling right, the answer is Candida. Okay, so Candida is the one which is plated on the chrome agar. Chrome means color, different colors they come on this. Okay, and you can do actually what with this, that is the Candida speciation. What you can do actually here, the Candida speciation. Okay, so Candida speciations can be done on which media? Chrome agar. Okay, this question can come again. And another aspect which can come regarding Candida albicans is that you also know Reynolds broad phenomena. Reynolds broad phenomena, and Reynolds broad phenomena is termed as germ tube formation. Okay, this is termed as germ tube formation. Germ tube formation, that is termed as Reynolds broad phenomena. Another one is chlamydospore formation, and this particular chlamydospore formation happens to be on which media? Corn meal agar. And why they produce this chlamydospores on corn meal agar? Because it's a nutrient deficient media. So to survive them, they have to produce certain spores Which one? That is the chlamydospores. So chlamydospores are there on the corn meal agar. Okay, so these two are also important for the Candida albicans. Another important question which I think can come is Candida krusei. Okay, this is a fungus which is resistant to azoles. This is the fungus which is resistant to azoles. And how to remember that? Remember in this particular way, krusei. Okay, krusei, that is kruse. Kruse is resistant to holes, that is azoles. Fine. So krusei, because if a kruse gets a hole, it will sink. So obviously kruses are resistant to azoles. So remember like that, the Candida krusei is resistant to azoles. Is it fine? Now, other than that, a favorite of examiner which is coming in every exam is beta-1,3 glucan testing. And beta-1,3 glucan testing is done for CAP, guys. Okay, beta-1,3 glucan testing is done for what? CAP. And what is CAP, guys? CAP is candidiasis. Okay, A is aspergillosis and P is pneumocystis carni. Pneumocystis carni. And here I like to add up one particular one, that is candidiasis is not normal candidiasis, it is invasive candidiasis. What is invasive candidiasis? Which is there in the blood. That is termed as invasive candidiasis. And the same thing goes for the aspergillosis, invasive aspergillosis, and pneumocystis carni or pneumocystis zerovicii. You all know that particular one is common in HIV positive when the CD4 count goes below 200. And what it does? It does pneumocystis zerovicii pneumonia, which does not involve lobes. There is a bi-perihilar opacities which are observed in this particular one. There is not the lobe involvement. And what is the drug of choice for this? Cotrimoxazole. Okay. Invasive aspergillosis is also having a test that is termed as galactomannan test. And I think this time they will ask this. Galactomannan test is also being done for the invasive aspergillosis. And invasive candidiasis means which have gone into bloodstream, which have gone into some other stuff, that is termed as invasive candidiasis, means into the brain also it can go. So that is invasive candidiasis. In that, this beta-1,3 glucan testing is done. Now, as Kishore have told beautifully that this particular one is not done in what? ये भी पता होना चाहिए कि किसमें नहीं करना. Okay, some people are confused that every fungus is having this particular beta-1,3 glucan. अब ये किसमें नहीं करना? It is not done. It is not done in Cryptococcus, okay, and it is not done in Mucormycosis. It is not done in Mucormycosis and it is not done in Cryptococcus, and it was recently asked. Okay, it was recently asked. Cryptococcus और Mucormycosis के लिए नहीं करना होता क्या? Beta-1,3 glucan testing. Is it fine? So this question more likely it is coming. What is the drug of choice with Candida? Azoles. Okay, that is fluconazole and all. Why Candida is important? Because this happens to be in immunodeficient individuals, and this particular in HIV positive is a very common infection. Mostly involves the esophagus, esophageal candidiasis and oral thrush. If you get a picture of it and they ask which drug, fluconazole you will use. Okay, which disease might be there? Esophageal candidiasis is happening? HIV. Okay, so HIV is there in that particular one. So that way you have to answer up in the exam. You have to correlate in this particular fashion. Okay, that which particular Candida is resistant to azoles? That is the Candida krusei. Which particular phenomena is observed here? That is the Reynolds Broad phenomena, chlamydospore formation on the corn meal agar. Is it fine? So these are the important ones. Beta-1,3 glucan testing is done for CAP. For which it is not done? Cryptococcus and Mucormycosis. Is it fine, guys? Now, this particular one, a 27-year-old man comes to the clinic due to the abdominal discomfort and diarrhea. He informed that his symptoms begin after return from a vacation 2 days back. On inquiry, it was found that he happened to eat a lot of local food from outside. The stool sample was collected that revealed pink colored rods. What is observed in that? Pink colored rods. Okay. On the wet mount, fish in stream appearance is observed. So guys, do you know this? That fish in stream appearance is observed in which particular one? Yeah, Kishore, it can do. Vaginal candidiasis for sure. Yes. And for that also the drug of choice is fluconazole. Yeah. Thick curdy discharge. Fine. So answer of this question, guys, fish in stream appearance and pink colored rods, that is there, and they want to ask up, first of all you should make the diagnosis of it and then the answer which likely can be here. Yes, I am waiting up. Please tell the answer of it. It interferes with the 60S, elongation factor it inhibits the release of acetylcholine, or it increases the cyclic AMP. What is your answer? Dr. Bhava, you are perfectly right. The answer is in and around the cholera. Okay, so it is cholera, and the answer is a twisted form. They want to ask regarding the cholera toxin. Okay, they want to ask regarding the cholera toxin, and cholera toxin actually increases what? Yes, tell me. Actually increases what? Please tell. It actually increases what? It actually increases cyclic AMP, as others are telling, right? Okay, fine. So cholera is a very important question which recently was also being asked, and this particular cholera toxin is having two components, A and B. B binds to GM1. This was asked in the last All India exam. GM1 ganglioside receptor. Okay, and A does ADP ribosylation. If you see my video, I have told up that this question is coming in the NEET PG. It was there in the NEET PG. Okay, so this is there. That is ADP ribosylation of GTP. And which G? G stimulatory. Which particular one? G stimulatory one, that is there involved in this particular one. Okay, GTP, ADP ribosylation of this. And because of these actions, what happens? There is an increase in the adenylate cyclase activity. And because of this adenylate cyclase activity increase, finally there is an increase in what? Cyclic AMP. And because of this, massive watery diarrhea happens. And this particular diarrhea is of which type? It is rice watery type. It is rice watery type, and rice watery type diarrhea resembles which metal poisoning? Another forensic question, arsenic metal poisoning. It resembles what? Arsenic metal poisoning. And another important aspect here is that the Vibrio cholerae acts on which particular junctions? Is it tight junctions or zonooccludens? Yes. Guys, both are same. Zonooccludens and tight junctions, they are both are same. It acts on there, and it is being asked that what is the best selective media for the Vibrio cholerae. The best selective media is TCBS. Okay, thiosulfate, citrate, bile salt, sucrose. If you are seeing up any sort of a green color media, this changing to yellow, this is the logic of TCBS. This is the best selective media for what? Vibrio cholerae. And how to remember that? Remember in this particular fashion, guys, VC ने क्या दे दिया? TC. Okay, VC ने क्या दे दिया? TC. और Pushpendra, you told darting motility. You are perfectly right. This Vibrio cholerae is having a characteristic motility that is termed as darting motility. And if you are talked about motility, let's discuss up at least three which can come in exam. That is tumbling motility, D is darting motility, and S is swarming motility. T is tumbling, D is darting, S is swarming. Okay, so this particular one, tumbling, tumbles means which tumbles over like a drunkard, and which fellow does it? Listeria. कौन करता है tumble? Listeria. कैसे याद रखोगे? Listerine. किसमें कर रहे हो? Tumbler में भर के Listerine. Tumbler, Listeria. Tumbling motility. Darting, you throw like this, it stucks to the wall, that is termed as a game, that is a dart. So darting motility is observed in Vibrio cholerae. Okay, it is observed in whom? Vibrio cholerae. Swarming is Proteus. बादल की तरह छा जाना उसको बोलते हैं swarming. like a cloud it spreads, that is termed as swarming, and it is seen in the Proteus. Okay, so now very good, swarming is seen in Proteus. Can anybody tell what is the slow form of swarming? The slow form of swarming is known as stately motility, and stately motility is a feature of Clostridium. Stately motility is a feature of Clostridium. Okay. Now guys, tell me regarding this. This is a simple one. Yes, very right, Pushpendra. Darting is also seen in Campylobacter jejuni. So now you tell me regarding Campylobacter jejuni, which temperature the Campylobacter jejuni loves to grow. Okay. At which temperature the Campylobacter jejuni loves to grow? Yes, Pushpendra. Tell me this also. Tell fast. Duckray is having school of fish, not stream fish, MA. Okay, so that's why I have intentionally kept that word, fish in stream. If they are moving like a fish in a stream, that is answer is Vibrio. Okay, school of fish is Haemophilus ducreyi. Campylobacter jejuni 42, you have answered up wonderfully, MA. And how to remember that? Campylo, camp, summer camp is having a temperature of how much? 42. Okay, so that also is to be remembered. Pushpendra, it is 42, exact 42. Now guys, tell me answer of this one. A supervisor of a company that deals with the woolen jackets recently developed pulmonary symptoms and later diagnosed as pneumonia. Which of the following feature is not associated with this organism? So like this is the correlation which we'll do in the exams. Siddharth, you are perfectly fine. This is pulmonary anthrax. Okay, so can you tell me the answer of it? Nil Sarkar have told D. So is everybody with the Nil Sarkar? Yeah, Pushpendra, very right. This is Bacillus anthracis, and as Siddharth have already told, this is pulmonary anthrax, also termed as Wool-Sorter's disease. Okay. Yeah, answer is D. Answer is D, guys. Here, carom coin colonies, they are not observed in Bacillus anthracis. Bacillus anthracis grows on the plet media, and it shows up these particular important entities, which we remember by a mnemonic Miss Bamboo. Okay, which we remember by a mnemonic Miss Bamboo. And what is there in the Miss Bamboo? McFadden's reaction. McFadden's reaction. And this McFadden's reaction is for which particular capsule of it? Polypeptide capsule demonstration. McFadden's reaction. How to remember? मैकडॉनल्ड्स की फ्राइज बहुत अच्छी हैं. ओके, BA Bacillus anthracis. मैकडॉनल्ड्स की फ्राइज बहुत अच्छी हैं. I is inverted fir tree appearance. Okay, or Christmas tree appearance. That is observed in that. S is string of pearls. मोतियों की माला on the penicillin agar is a feature of this. And bamboo, you already know. Bamboo stick appearance is observed where? It is observed in the gram staining. In the gram staining, it looks like a bamboo stick. And what about, yeah, Pushpendra, Medusa head also you can say, McFadden's reaction I made it, because Medusa head is not so important. Okay, so bamboo stick appearance. Bamboo stick appearance is observed in the gram staining. Fine. And the spores of it, they are not bulge. Okay, and they look like a cable car. Okay. So non-bulging spores, this is also a question. Non-bulging spores is observed in Bacillus anthracis. So in a quick fire, I like to tell 3-4 points regarding Bacillus anthracis. One is Bacillus anthracis is category A bioterrorist weapon. First point. Second point is cutaneous anthrax is also termed as Hyde-Potter's disease, and it is also termed as malignant pustule, and it is easy to treat. But this pulmonary anthrax is not easy to treat. It does hemorrhagic mediastinitis, which later on leads to death, and it happens in 20 years round. Okay, it's an occupational hazard. Okay, then you have the other aspect of anthrax, that is intestinal anthrax, which is also being asked, that due to the contaminated wild animal meat, that intestinal anthrax happens. Fine. So these are the important entities which you should know regarding the Bacillus anthracis. And if somebody asks you which is the culture media, answer is plet. Okay. Now this is like favorite of all yours, and you must have done number of times this particular one. The disease that mimics the condition shown in the image below. Duckring you do, Siddharth, very right. You treat up with a formaldehyde to treat the spores. Tell this answer. Yes, guys, tell this particular one that this particular condition which is there. What's your answer for this particular question? What's your answer, guys? Tell me. What's your answer in this? Hey, I'm waiting. Answer is Siddharth have told B, and Siddharth is right. Sana is also right. Kishore is also right. So basically the picture is given of Madhura foot. Everybody knows. But if you know this thing that butyriomycosis produces mycetoma-like lesion. Okay, what does it produce? It produces mycetoma-like lesion, butyriomycosis. And this is done by which particular bacteria? It is done by Staph aureus. Guys, it is done by what? Staph aureus. What thing? Butyriomycosis. Okay, so this is mycetoma-like lesion. Athlete's foot, obviously, this is a fungal infection, nothing to do with that. Club foot is CTEV, and babesiosis, nothing to do with this particular picture. So answer to this question, that it mimics what? It mimics butyriomycosis, and butyriomycosis takes it to the Staph aureus. Okay, so 3-4 points regarding Staph aureus. It does what? It does food poisoning. Okay, and incubation period is how much? 1 to 6 hours. Vagomimetic action is there. Which toxin is involved? Antirotoxin A, and it's a heat stable toxin. First point. Second thing, there is skin scattered syndrome that associates with ETA, ETB, antirotoxin A and B. And the super antigen here is which one? Toxic shock syndrome 1. Staph aureus is the most common cause of what? IV drug abuser endocarditis. This most common cause is Staph aureus. Okay, right or left? Overall it is Staph aureus. Native valve endocarditis, that is the acute bacterial endocarditis, that is also being done by which fellow? Staph aureus. In the MRSA, which gene is involved? MAC-A gene is involved in the Staph aureus, because of which this becomes a MRSA. What is the drug of choice for MRSA? Vancomycin. Vancomycin is the drug of choice for MRSA. Is it fine? So these are the important points which you need to know regarding the Staph aureus. Without that, you should not go into the exam. Okay? Right. Now guys, can you tell me this? Like few questions more we have in this, and later on then we'll wrap up. Okay? Which of the following stages of the malarial parasites corresponds with the relapse in the Plasmodium vivax? Yes, please tell me. Which particular stage associates with the relapse in the Plasmodium vivax? Yes, please. Tell. What is the answer of yours in this? Left-sided they say Antirococcus, but Siddharth, this is like controversial. Right and left overall they will ask, and that is the Staph aureus. Yes, please. Which of the following stages of malaria parasite correspond with the relapse in the Plasmodium vivax species? Yes, please. The answer is very right, guys. Very right. You all are perfectly fine. Answer is hypnozoite. Okay, and hypnozoites were there in the liver, and they are responsible for the relapse. In the case of whom? In the case of vivax and ovale both. Vivax and ovale both. Fine. And for this relapse only you give what? Primaquine. For this particular only you give what? Primaquine. Can you tell me in which particular species of Plasmodium the size of the RBC increase? Answer is vivax and ovale. This also you know. Okay, banana shaped gametocyte is a feature of Plasmodium falciparum. Which is the most dangerous Plasmodium? Plasmodium falciparum. Okay, what is the infective form for Plasmodium? Sporozoites. Which is the definitive host here? That is the female Anopheles mosquito, because sexual cycle happens in female Anopheles mosquito. Is it fine? Besides that, in which the recrudescence happens? Answer is Plasmodium falciparum. Okay, acalforms is seen in Plasmodium falciparum. What about the Siemens dot? Siemens dots is a feature of Plasmodium malariae. Band shape is seen in Mala malariae. So all those are important entities which you should know regarding the Plasmodium. Is it fine? Now guys, this way also the question can be asked in the exam. Yeah, very right Pushpendra. Amber is the mnemonic. Acalforms, all age RBCs, Morris dot, banana shaped gametocytes, and recrudescence along with the renal failure that is observed in the falciparum. Okay, very right. Guys, this can come in the exam. Can you tell me this particular one? A child presented to the emergency department with a history of rhinorrhea that is the coryza, non-productive cough, and red eyes, that is triple C. And triple C is for what, guys? Triple C is for measles. Okay, triple C is for measles. Dr. Mridul have answered beautifully. It's a single stranded RNA virus. Now you tell Mridul, is it enveloped or non-enveloped? And Dr. Mridul is right here also. It's a single stranded RNA and it's a enveloped virus. And what you're observing in it is, that is the complex spot, which is pathognomic of measles. Which particular giant cells are observed in that? Which inclusion bodies? Warden-Finklade giant cells. Rash 4 days before, 5 days after is the infectivity form of measles. Okay, infectivity time period is 4 days before, 5 days after. Okay, so this everybody knows, I suppose. And Warden-Finklade giant cells is important, and a chronic late complication of it, which is termed as SSPE, subacute sclerosing panencephalitis, which happens in the school going age after this episode, that is asked in the exam. Okay, which is having the burst wave pattern on the EEG, and suddenly the child develops altered sensorium and deteriorates in the studies, and having a history of rash with fever in the childhood. We are talking about measles. Okay. So these, be prepared for this type of questions, that single stranded RNA, double stranded RNA. For that, I just want to tell you, most of the RNA viruses are single stranded except the rotavirus, which is wheel shaped, responsible for the most common cause of diarrhea in the children, rotavirus, okay, which is wheel shaped also, and that is double stranded RNA. And a single or most of the DNA viruses, they are double stranded except the parvo, which is a single stranded DNA virus. And parvo leads to a disease, slapped cheek appearance, erythema infectiosum. Okay, so like that they will give you a disease and they want to ask up in this particular fashion. And this I have already told you. Non-enveloped one are which one? PAP, parvo adenopopova, and non-enveloped RNA viruses are which one? PAC, Picorna astro Rio calci. Is it fine? Now, this particular thing, this you already know. A 45-year-old female presented to the clinic complaining of swallowing difficulty, generalized weakness. Okay, physical examination performed. There was no hyperemia, pharyngeal exudate found. She also complained of diplopia, eye exam, ptosis. Ptosis, this word itself is telling you answer, what we are talking about. On asking, she confirmed she feels better with rest. The condition mentioned here is example of which hypersensitivity. So can you tell me, guys, what is your answer in this? Which hypersensitivity we are talking about? Yes, please. Which hypersensitivity we are talking about here? Tell. Pushpendra, you are perfectly right. The answer is B. Answer is B. Type 2 hypersensitivity. Guys, the first one is anaphylactic type. Okay. Type 2 is cytotoxic. Type 3 is immune complex mediated. Type 4 is delayed type. All types of type 5, else type 2, it comes under that particular one only. So anaphylactic, all sorts of allergies. That is done. Okay, all sorts of allergies like bronchial asthma, atopy, Pushner-Kushner reactions, Skulls-Dale phenomena. So all they come in the type 1. Which immunoglobulin? IgE is involved up. Which T helper cells? Which T helper cells, guys? In the type 1, which particular T helper cells are involved? T helper 2. And which particular interleukin is released? Interleukin 4. Okay, interleukin 4. So this also needs to be remembered. Then comes the cytotoxic one. Cytotoxic one means antigen is there, over that the antibody is sitting off, and that particular antigen is attached, it's a part of the cell. Okay, so cell part is only the antigen, it is sitting over that, so that is termed as cytotoxic one. Immune complex one, they are free, they are not over something, they are free antigen and antibody, and delayed you already know. Okay, so remember this particular aspect, that in the cytotoxic one, all the blood disorders, okay, autoimmune hemolytic anemias, okay. So I have a mnemonic also for this. My blood group is Rh positive. So myasthenia gravis, Graves disease, okay, they also come in the type 2. This particular ITP, TTP, they also come here. Besides that, those particular ones, Goodpasture syndrome, fine, and these particular one, pernicious anemia, they all come in the type 2 one. RH incompatibility, which is the recent question, RH incompatibility, erythroblastosis fetalis, they all in type 2. Arthur's reaction, serum sickness, they are in the type 3. SLE is there in type 3. Okay, PAN is there in type 3. And in the type 4, what you have, lepromin test, tuberculin test, okay, like Fairley's test for schistosomiasis, Fry's test, these all are in the type 4. They are the delayed type. They are the delayed type. Is it fine, guys? So this is very important chapter. Definitely one question is there from this. Now, another question which is coming in every exam here and there is this one. That is this particular picture, like because time have happened more. So I like to tell directly that what you're observing in this picture is septations. What you're observing here, septations, and they are arranged at an angle that is 45 or 60, acute angled, and they are septate. We are talking about what, guys? We are talking about aspergillus. We are talking about aspergillus. If would have been mucormycosis, then this type of hyphae, aseptate hyphae, and the angle is obtuse angled. Okay, angle is obtuse angled or right angled. And why the mucor is now very important, why it is termed as important one? Because it tends to happen in those fellows who are on a prolonged steroids, and this have happened because of the COVID-19. So this, I suppose, is very clear to you. What is the drug of choice? LAMP. This is already know. Aspergillosis we have already discussed up. Fumigators, Niger, flavors, they are there. Aflatoxin leads to hepatocellular carcinoma and all. So all these are important entities. Important is septate hyphae, dichotomous branching at angle of 45 or 60. Okay. Now, another favorite one. She usually feels pains after intercourse, and after seeing up this picture, immediately what should come in your mind? What should come in your mind after seeing up this particular picture? This is a trophozoite. Trophozoite of whom? This is a trophozoite of, yes, Trichomonas vaginalis. Okay, this is a trophozoite of whom? Trichomonas vaginalis. Can you tell me about the cystic stage of it? Guys, cystic stage होती ही नहीं है इसकी. क्या नहीं होती? Cystic stage इसकी होती ही नहीं है. This is the protozoa which does not have a cystic stage. You have a trophozoite and it is having twitching motility, okay, or jerky motility, and strawberry cervix and strawberry vagina is a feature of it, which is also termed as Colpetis macularis. pH raises more than 4.5, and the drug of choice is metronidazole, and it is given to both the partners because it is a STD. Okay. Regarding the Gardnerella vaginalis leads to bacterial vaginosis, and it is also having pH of more than 4.5. Whiff test comes positive. It is fishy in order, and greyish white discharge is characteristic of it. Here it is greenish to greyish. It can be both. Fine. There it is mostly greyish one, and you observe certain cells that is termed as clue cells. And drug of choice there also is what? Metronidazole. In pregnancy, what? Metronidazole. Okay. Giardia, another one in which metronidazole is used. It does watery diarrhea sometimes, and it also does fat in stool steatorrhea. And this is having which motility, guys? Falling leaf-like motility. Falling leaf-like motility. And gonorrhea, you know, it is having a mucopollulant discharge, and it flows like a semen. That type of discharge is thick discharge is there in this particular one. And the drug of choice for gonorrhea is ceftriaxone. That is the third generation cephalosporins. But here we are talking about which, guys? Trichomonas, which does not have a cystic stage. Which does not have a cystic stage. Now, if we see this particular picture and come to a conclusion that what we are talking about the egg of Ankylostoma duodenale. An Ankylostoma duodenale egg is having blastomeres, 4 to 5. In this you can see 4. Okay. And another local name of this is hookworm. And Ankylostoma brasilensis is there, which leads to which migrants? Cutaneous larvae migrants. Which other fellow does cutaneous larvae migrants? That is larvae currents. That is the Strongyloids stercoralis. Okay, Strongyloids stercoralis. Bilkul Siddharth, you are perfectly right. Okay, so this is the Ankylostoma duodenale stuff. And in a very fast way, I like to tell you some of the important eggs. Okay, by this particular one, and you should see that. Trichuris trichiura. Okay, Trichuris trichiura, dumbbell shape. This is dumbbell shape. Antrobus vermicularis, plano-convex. Inside that there is a tadpole. Okay, this is hookworm, which we have just seen. Okay, blastomeres. Then you have H. nana, which is having polar filaments on both the sides in between the central hooklets. What is drug of choice? Praziquantel. Okay, Taenia species they have asked up. Taenia species looks like this way. This is Taenia species. Okay. Cystosoma hematobium, Cystosoma mansoni, Cystosoma japanicum. Hematobium is having a terminal spine, lateral knob. Drug of choice, praziquantel. Okay, drug of choice, praziquantel. Fine. Chlorichae sinensis is having this type of a egg. Leads to which particular thing? Cholangiocarcinoma. Okay, bile duct carcinoma. Diphyllobothrium latum, fish tape form, leads to which anemia? Megaloblastic anemia. Okay, megaloblastic anemia. The starting ones, this is the Ascaris egg. This is the decontated egg. Outer covering is not there. Okay, this is embryonated egg of Ascaris. Okay, and how does the infection of Ascaris happens? By eating the eggs. Eat. Antrobius, Ascaris, Trichuris trichiura. Those who enters through the sole of the foot, flariform larvae, ANS. Okay, Ankylostoma, Nicator americanus, Strongyloids turcoralis. Okay, most of the nematodes are treated with what? Albendazole, except whom? Except the Strongyloids turcoralis, ivermectin. Then you have those particular fellows also, Phyllotaceous ones. They are also nematodes. They are tissue nematodes. For them, for the Wuchereria bancrofti, you use what? For that you use DEC, diethyl carbamazine. And for those particular ones, lower and all, also you use the same thing. Is it fine? So these all are important ones regarding the various eggs which you should know. So guys, I suppose we have done a lot, and if you focus upon these things also, a lot of questions you will able to solve up in the exam. So from my side, a very best of luck, and every time I say the same thing, and that is so true. That is, मैं लगा रहा था उम्र परिस्थितियाँ बदलने में गालिब. अभी सब क्या कर रहे हैं कि पेपर पोस्टपोन हो जाए, ये हो जाए, वो हो जाए. अरे छोड़ो, अब एग्ज़ाम आ गया भाई, एग्ज़ाम की तैयारी करो. ठीक है. मैं लगा रहा था उम्र परिस्थितियाँ बदलने में गालिब. जिस दिन मनस्थिति बदली तो फिर फ़र्क नहीं पड़ता कि पेपर कब है और क्या है, सब कुछ सही हो जाएगा. जिस दिन मनस्थिति बदली, परिस्थितियाँ खुद ब खुद बदल गई. तो यही होता है ज़िंदगी का फंडा. सब यहाँ पे है. और शुरू में जो डिफ़िकल्ट लगता है, एवरीथिंग स्टार्ट्स फ्रॉम ज़ीरो ओनली. और जो चीज़ ज़ीरो से स्टार्ट होती है वही आगे फिर इतनी बड़ी बन जाती है. सो धीरे धीरे ही चीज़ें ट्रांसफॉर्म होती हैं. और तुमने अपना पूरा साल दिया, यू हैव लाइक गिवन अ फुल ईयर. डोंट वेस्ट इट इन पोस्टपोनिंग स्प्री कि मतलब ये पोस्टपोन हो जाए, दैट पोस्टपोन हो जाए. अब नहीं हो रहा है फॉर श्योर, बिकॉज दे आर वेरी एडमेंट. अगर हो जाए तो अच्छी बात है, दैट इज़ ऑल्सो ट्रू. लेकिन अगर नहीं हो रहा तो तुम तो ये मान के चलो ना, नहीं हो रहा, ये क्यों मान के चल रहे हो, होगा. सो डोंट वेस्ट योर टाइम, फोकस्ड ऑन दैट पर्टिकुलर वन. Okay, focus on that particular one. Though those are blank pages, Siddharth, don't worry, they are not there. Okay, so besides that, focus on these particular aspects कि मतलब postpone वाले चीज़ से हटो और अपनी पढ़ाई पे लगो और इनको पूरा करने की कोशिश करो. Is it fine? And very best of luck from my side, and thank you so much. Thank you so much to be here. And at last I received 50 in the top chat. That is half century of mine have happened up. And धीरे धीरे it will grow up for sure. Okay, so thank you so much for joining up. Thank you from my side, and very best of luck to all of you.